Hi, my name is Dr. Jeremy Thomas here at Integrity Dental in Pueblo, Colorado, or the greater southern Colorado area. Today we want to talk about veneers and some of the commonly asked questions we get associated with dental veneers. Veneers are done in lots of different construction and different kinds of professions where you put something on the surface that hides what's underneath. And that's essentially what we're doing with a dental veneer. They're typically done on front teeth, the ones that you commonly see when people smile, and they go on the front of the tooth to hide what is underneath, the tooth structure that's underneath that, just to make the smile look better. Dental veneers are pretty much used to solve cosmetic and aesthetic problems. Things that people don't like about their smile, whether it be turns and twists and things that aren't lined up very nicely. So they can be an alternative to orthodontic treatment or braces for some people. They can also be used to hide bad or any discoloration, stains or white spots or things on the tooth structure that patients find to be less than optimal when they're looking at their smile. Are veneers permanent or removable? Well, a good veneer is definitely permanent. There are popular things that I've seen recently where you send in some sort of impression and they send you something back in the mail and it kind of clips on over the top, and that is definitely temporary, and I would caution you with that because that means you're not able to clean underneath there. And I've seen a lot of problems that can pop up with new cavities and gum disease starting underneath these clip-on veneers that people are getting from not doctors, from from places online or what have you. A lot of dangers associated with those. What should I expect in the process of getting veneers? Well, at Integrity Dental, we have a pretty neat process to where you can get veneers the same day. You get them all done at once. So there can be tooth prep, meaning drilling on the tooth. There are, at times, ways to do veneers without having to drill in the tooth at all. It really is kind of patient specific, both preference wise, but also to do what we call a no prep veneer, you kind of have to meet several certain criteria as far as mouth health and positioning of teeth and things like that. No way to tell you if you're a good candidate for that without actually looking at your mouth. Will veneers match the color of my teeth? The answer is yes, absolutely, but there are varying degrees of matching. The typical dental veneer appointment at certain offices would be drilling the tooth down a little bit, minimal. That's the idea behind a veneer. And sometimes you don't have to do that, like I mentioned earlier. In a no prep veneer, you take an impression, send it to the lab, and you'll have temporaries during that 2 or 3 week period, and then they send them back and they are cemented in place. They're permanent, and you hope for a good color match. You have shade guides and things like that you try to get close, and you take pictures and you try to tell the lab tech what colors and characterizations to put on the tooth to make them match the patient. At Integrity Dental, one of the advantages we have is we do that veneer process and procedure all in the same day. No temporaries needed. We have a machine that makes them in our office, and because of that, we get to match shades and colors right there in our office. And if we're off a little bit in our shading, or the patient isn't happy or wants a small characterization added or something like that, we even have the ability to go back and reshade and modify the shade a little bit right there in the office that same day to make sure we get a very, very close, imperceivable color match to where the patient leaves looking like they just have natural teeth. And that's what's really important to me when we're doing this sort of procedure. What are the pros and cons of doing porcelain versus composite veneers, and what's the difference between porcelain and composite veneers? Material is the biggest difference. Porcelain is a glass or ceramic that is very color stable, meaning they don't stain. Even compared to teeth, they won't stain nearly to the degree of what your teeth will. And we can make them whatever color. They're also very strong. porcelain can be extremely strong, in some cases even stronger than our own natural enamel is. So because of that, they're a very robust restoration. Composites are very different. You can actually do composite veneers the same way that you do porcelain veneers, where a machine makes them, and those are better composite veneers. You can make them to the shapes a whole lot better, match and make them look a whole lot more natural, and they stain less. But any sort of composite is going to stain more and not last as long or work as well as porcelain. They're also softer. They're going to be softer than natural tooth structure, composite veneers are. And a lot of composite veneers are also done directly, meaning they're just bonded onto the patient's tooth, and then it's the dentist's responsibility to try to shape them directly in the mouth, trim them up in the mouth to make them match the patient's overall alignment and shape of tooth, which is tough to do. Anytime you're doing it directly, it's just like doing a filling. You do it directly in the patient's mouth, you have a lot harder time matching colors and matching shapes. There's a lot of talent and learning that goes into doing that and doing that well. As a dentist, not everybody can do it well. And I'll also caution people in that you're never, no matter how talented the dentist, going to get as good a result out of a directly applied composite veneer compared to doing an indirect, meaning you make it in a machine, composite veneer or porcelain veneer. There's a big difference in quality. So if we're talking about porcelain veneers, which is my recommendation and my preference to do because of the longevity and the color matching and the natural look to them, the process varies more based on how many teeth you're talking about doing. If you're doing a single tooth veneer, the range is you're going to be there for about an hour and a half to 2.5 hours, just depending on the complexity of the situation a little bit there. But if you're doing, say, 6 or 8, say the front 6 or 8 teeth on the top, which a lot of patients do to really make a big difference in their smile, that's going to be a longer appointment. You're probably going to need to be there for a full morning or a full afternoon appointment, 3 to 4, sometimes 5 hours, depending on how complex the situation is. Do dental veneers require special care as compared to our regular teeth? Probably not much different. You're able to floss in between them and clean them just like regular teeth. The only thing is that sometimes people elect to go the no prep veneer route. And when you do a no prep veneer route, that means you're just putting a shell on top of the existing tooth structure. And that means the tooth is going to be slightly fatter. It feels a little bit fatter to your lip, you know, just the feel of it there. And because that they stick out off the base of your tooth just a little bit, so the gums can require just a little more specialized care, a little more attention when you're cleaning when you do that, but it's pretty minimal, the difference between cleaning veneers and cleaning your own regular teeth. How long do veneers last? There's a big variety there as well. I tell patients frequently that I can do the best dental procedure ever, and if a patient doesn't take care of it, that could fail within a year. And I can do a crappy dental procedure, and if a patient takes good care of it, it can last 10 to 20, 30 years. So how a patient takes care of restorations plays a huge role in how long things last. But I would tell you the average dental veneer, if it's taken care of well, is going to last between 15 and 20 years. But I've also seen them last 30 to 40, 50 years in patients that take excellent care of them and aren't too hard on them as far as the kinds of foods they eat, or they avoid chewing on them. You know, dental veneers are meant to look nice, and as far as chewing hard things, biting off beef jerky and carrots and apples and hard stuff with those front teeth, that's not always a wise idea. It can lower the longevity of those. So when you get dental veneers, I typically recommend that you get in the habit of cutting up your food or using side teeth more to bite stuff off, just as a way of helping to protect them or increase the longevity a little bit. What is the cost of dental veneers? And are there ways to help patients finance those kinds of procedures? And yes, there are ways to help finance that. It can be a huge quality of life improvement to have a veneer procedure done when you're happy with your smile and you smile a lot. It can affect your demeanor, the way that you interact with people, and confidence levels, things like that. And it's a fun dental procedure to be able to take a patient that comes in with a less than desirable or less than optimal smile and to send them home that same day with a beautiful smile, one that they are confident smiling in pictures with. It's a very rewarding procedure when I do that for patients. So we enjoy doing it. There's some expense, some investment involved with doing a veneer procedure, but there's a range. It depends on how good the substructure is. How good is the tooth that we're putting it on? Does that tooth require some buildup? So I'd say the bare minimum, if you have perfectly healthy teeth, just teeth that are not looking real nice, that don't require any sort of buildup, you're probably looking at close to $1,000 per tooth minimum. But if you need substructure work done, that increases things significantly. Can increase things significantly, where you could be looking at $1,400 to $1,500 per tooth in that sort of situation. So when you're talking about doing a full smile, you're talking about doing 6 to 8 to 10 teeth sometimes, if you have a big wide smile. And so if you're talking about doing 10 teeth at $1,000, you're looking at $10,000 to totally make over that smile. And it could be more than that. So sometimes financing is a very helpful thing for patients in that situation. At Integrity Dental, we have several options available, from in-office financing to Care Credit and Alpheon and things like that. And we also work with some bank patients figure out financing as well. When should I schedule an appointment to get veneers? Well, the sooner the better. If your smile is being affected by your feeling of how your teeth look, if you're not smiling as much as you would with a nice smile, that can have large repercussions on people's lives, whether it be job interviews or just the confidence to perform at a certain level, to getting different job opportunities, or meeting your spouse or significant other, and opportunities there. I mean, it just is, it can make a significant difference in people's lives, having a good smile versus not having a good smile. One of the most commonly cited number one first impression issues that people say they make their first impression on when they look at meeting a new person is their smile. I think that's number 2 on the list, next to how people talk, their vocabulary, if you look into the science, which is, I think, about 30% of people make their first impression judgment, at least partially, based on the quality of your smile. So a good smile affects your life significantly. I can't enforce enough how much of a difference that would make in your life if you have a good smile versus a bad one. Well, we love changing people's lives and helping you smile confidently at Integrity Dental. Matter of fact, you can find us on the web at letushelpyousmile.com. But if you're interested in dental veneers, please let us give you an idea on what it would cost, and let us help you in that area. It's something we love to do and do a lot of. And our phone number, 719-545-2468. Call that and we'd be happy to get you in for a free consultation to give you a good, accurate number on what it would cost to get you a beautiful smile using dental veneers.